The coronavirus infection in some ways is a bit of an insidious and occult killer, but it's actually not just the virus itself that causes death. It's the secondary pathology that this tiny virus causes that wreaks havoc on the human body. Research on the growing number of cases, deaths, and autopsies of those who have unfortunately died from the coronavirus shows a huge amount of clot and thrombi burden, which are essentially clumps of blood and red blood cells, which travel throughout the body and can block blood flow to vital organs. But how does this virus cause our blood to clot? Well, let's think about our blood vessels. Our blood vessels are a lot like water pipes underneath buildings. The pipes are open, allowing water to freely flow within it and provide essential water to a building on the other end. In fact, these pipes are galvanized pipes, which means that there is a protective coating, zinc, to prevent corrosion and rust. Let's say that this pipe gets damaged on the inside, and now that protective zinc coating is lost in a part of the inner pipe surface. Now water and oxygen has a chance to damage the underlying steel, which is prone to corrosion and large rust formation. This large rust burden will inherently block water flow and then cause lack of water flow to the building at the end. Our blood vessels are very similar. They have to transport blood instead of water, and they have to stay nice and smooth on the inside. But we don't dip our blood vessels in zinc, now do we? Instead, we have what's called endothelial cells that line the inside of our blood vessels. These prevent rust from forming. And in the human body, this is a little bit more analogous to a thrombus formation or a blood clot instead of rust. If that lining is damaged, clotting factors form, and red blood cells and platelets will start to get stuck at this spot. This occurs rather quickly, forming a larger and larger blood clot that could eventually cease blood flow in that vessel. But how does the virus attack these endothelial cells to begin with? Endothelial cells have a receptor on them called the Ace2 receptor. Now, this may or may not sound familiar to you, but the Ace2 receptor is the same receptor on respiratory cells in our lungs. As you know, the virus is well known to attack our lungs because the virus enters those cells via this receptor on their surface. We now know that this receptor is also found on endothelial cells, and the virus can attack them if the virus is within the bloodstream. This will damage the endothelial cell, damaging that vessel's inner lining just like the inside of a water pipe, causing blood to clot. That's why when we have a very sick patient, they can form DVTs in their legs and other parts of their body, called deep venous thrombosis, and pulmonary embolism, meaning the blood clot traveled to the blood vessels of their lungs. And this is why we treat them with heparin, which is an antithrombotic agent, or basically preventing a blood clot to form and prevents future blood clots from occurring in our very ill ICU patients. On top of that, these ill patients may have other comorbid health issues that cause them to clot even more, such as obesity, immobility, and a history of smoking. Clotting isn't the only thing that can kill our patients. It's also large bacterial infections. Again, the coronavirus infects our lungs via the lining of our alveoli, or the oxygen exchange units of our lungs via the Ace2 receptor and direct contact. This damage can cause some of the cells that have cilia or hair-like projections that act as a filter to prevent bacteria from entering our lungs. If this filter is damaged, the bacteria can get into the lungs, and the nice humid lung atmosphere is perfect for growth and causes an opportunistic infection. This is called a superimposed bacterial infection or a superinfection. This bacteria will damage our lungs even more, prevent oxygen exchange, and many patients who are severely ill will need a ventilator to stay alive, while the IV antibiotics help kill off that bacteria. So it's not just the virus itself that causes death, it's the clots and bacterial infections that occur in the body that really wreaks havoc on our patients. Remember to continue to wash your hands, practice safe hygiene, and socially distance, even now as the states and local governments are slowly lifting the quarantine.